тривалості приблизно скільки от меседжі від вас? Десь хвилин 20-30 в цілому? Шановні колеги, будемо продовжувати робочий день в українському.
We continue our working day. The next topic is plan of reforms in the State Expert Center, ensuring access to high quality, efficient and safe medicines. Our guests are Ilyk, Deputy Minister of Healthcare of Ukraine, and Tetyana Dumenko, Director of the State Expert Center of Ukraine. Microphone. The first one is Mr. Ilyk. First of all, I would like to remind that in the Ministry of Healthcare, I'm responsible for that activities in the ministry, and that is why I participate in our today's briefing. The presence in the market of Ukraine of the medicines is ensured by the Ministry of Healthcare after they are registered and re-registered. In accordance to the regulations, these procedures require, first of all, very careful expert analysis of registration materials, and that is the work which is being done by the State Expert Center, which is a structural division of the Ministry of Healthcare. Using this opportunity, I would like to share my thoughts on the planned improvement of the work of this advisory body, its format and tasks that the ministry gives to this expert center. The guarantee of that the efficient, high-quality medicines will get to the market. That is how the ministry formulates the task to the team of the center, and that is the task of the team, which can combine the progressive ideas and practical application of modern approaches to that. The dynamic development helps us hope that we will be able to improve the situation with the registration and re-registration of the medicines. The ministry supports the initiative of the center as to optimization of the procedures, which will allow to make decisions on getting to the market of medicines in timely manner. We have given you some materials where you will see the procedure of registration, how it's happening now and how it will be happening in some time. What are the advantages in this model that we suggest? Everyone can read it. And basically, the saving of time and resources, that is what the ministry hopes to be the result of this work, is one of the things which is reflected here. For more than 6 months, the ministry has been working closely with the EBRD project, which in which the international experts are involved in audit. We have received the preliminary report, and the key messages in this report which we received is improvement of the process of transparency during the state registration, and also the procedures of state registration in accordance with the existing requirements of the European Union. Besides the expert analysis and the recommendations, we believe that there will be a very active work made by the center. And for that, we have prepared all the necessary regulations and norms. We hope that we will soon receive the approval of this document by the Ministry of Justice, and the yellow cards will start to be actively and successfully used in Ukraine, so that we can prove the efficiency of the medicines, and we will be able to use this model in maximum, to its maximum. That is what explains our personnel policy. We are especially looking at the professionalism of the workers, of leadership. We are looking at managerial skills and practical experience of work in regulation of the circulation of medicines. I would like to remind you that in the result of the open competition, the Tetyana Dumenko is appointed the head director of the State Expert Center of Ukraine, and I will give the floor to Tetyana, and she will tell us about what this center will be doing. We liked her presentation during the competition, and we hope that in the first 100 days we will hear the results of the first 100 days, and every quarter we will hear what's happening, and in the result of the reports we will make a decision as to the contract and the extension of the contract of this director.
Good afternoon. I would like to share my views, and also I would tell you about the tasks that we have as the state registered body in concerning the optimizing of the work of our institution. I would tell you about three areas of work. This is transparency, quality of services provided for those who address our center, who uses these services. And the third important direction is the provision and provides for the carrying out of tests, and this is the main areas of our enterprise's activity. We can be modernized and improved to face the challenges that life proposes to us. And I would like to start with the first issue, transparency. We worked on this before contest, and I worked as an acting director of the State Expert Center, and we were able to communicate our plans, and today I'm ready to show some plans for the next year. Concerning transparency of the work of our center, we implemented some measures and made some steps in the area that at the start of development of the medicine, there should be information available on testing, and we carried out a number of consultations together with the representatives of European Business Association, where we discussed the tasks, and there should be basis of clinical research, and information should be provided for those who want to carry out these tests and those who ensure lives of the patients. But the most important, this information should be provided to our patients. that will be able to timely get it and to join these programs, and we hope that this will lead to the dissemination of the information about tests, clinical tests throughout Ukraine. And concerning access to information on the activity of the center, we made several steps in this direction. At the request and in accordance with the current legislation, and you know that state enterprises like ours should make public their reports about the activity for the last 3 years, and on our site there is detailed information and reports on this. And to avoid conflict of interests, starting from meetings that were held in October, November, some changes were introduced, and the procedure of informing about conflict of interest was established. So the team implemented these measures, and about the quality of the services, we see great potential in continuous training of our experts, and I would like to share our experience. That is the first project. So we trained our experts in October in European institution, and this inspection will be carried out on one of our bases to study the situation there. And for the first time, our specialists were partners in this verification. And we see great potential in the continuation of communication with our partners, international institutions who deal with the issues of registration of medicines. Also, increased responsibility of experts, and there should be higher motivation of experts. And you know that recently no measures were implemented in this area, and we plan to increase the salary of the experts and to identify individual contribution and individual skills. And we believe that this will motivate experts to carry out quality work that will be timely and of high quality. Also, one more aspect, starting 2014, our institution is certified according to the standards. On the 25th of November, there will be additional audit on quality of management, and in February we plan to be recertified and to keep up with the new standards of quality management. And also timely procedures, and this is a question that is raised by experts and by people, because sometimes there is a break in treatment because of re-registration of some medicine, and we made everything possible in order to resolve this issue. We held some meetings, and we plan to have more of these meetings in order to have this problem solved. So we have 65% by and we see potential in the optimization of the processes of electronic submission of the documents. We should have ambitious plan, but at the same time we should be realistic. And today we are able to introduce electronic application as the result of the development of visualization system that is now used by our applicants. And people got individual keys for access to the system, and they can enter the system And we hope that this will be good for the youth to apply in electronic way. And infographics presented by my colleague shows the time saving, and this will also increase quality of tests and also timeliness of these procedures. And also in the center, every day we get many applications and requests, and now we have 4,500 applications, and I ask the applicants we should be partners and we should work together in order not to have delays in registration and the information that applicant enters that this information is true and does not need corrections, and this will reduce time to get permits, and we in this way can avoid the situations that happen now. In the course of a test, there are some the certificate may expire, and this is our common goal, and we are ready to be partners in solving these issues. And one more idea, and I would like to say that Ukraine is one of the countries that is ready to gather data, and it is working in this direction and modernize its resources. We have new information resources concerning collection of data on side effects, and we are ready to collect this information from 4 sources of informing, from doctors, drugstore personnel, and applicants, and from the customers. So, in this way, we can establish that only quality products are in the market. And the main idea we want to express, and we want to communicate this idea to the media and to the public, to the applicants. The main message is registration, and any procedure that is carried out by a state expert center is the guarantee that quality products will enter the market, and this should be done openly, transparently, and simple way. Thank you, dear colleagues. Do you have other questions or clarifications? Please introduce yourself first and then address the question. Anna Levchenko, Interfax Ukraine. Tell us, please, in this material, so it is shown that is some provision of the Cabinet of Ministers or a draft law is needed, or the order of the Ministry of Health is needed for implementation of this?
We hope that we will launch the test version. This does not require any changes in regulations. This requires just to get our internal resource involved into that, and we're ready for that. Any other questions or clarifications? Oksana Kuyans, volunteer, medical control NGO. My question is, we wrote in our NGO about the facts of the conflict of interest of the experts of consultative expert group. We sent our request but have not received any reply, and we would like to know what are you planning to do with the conflict of interest, and what will you do with those who have the conflict of interest? Yes, thank you. We received your request. We are preparing the answer, but I can already tell that the main messages in the reply will be whether there was any prevention to execute the conflict of interest in 2014 and 2016. It will probably be not correct to answer that, but we understand that we as part of our work, we are planning to make a register of experts who will allow us to clearly understand to what stages of expert analysis our experts are invited. It is important for us to expand the circle of external experts, and we discussed it with the representatives of expert groups and National Medical Academy, and also how to react to information as to potential conflict of interest. I don't like when people say when we are making some retrospective decisions, but I like preventive measures. If there is information that there is a possible conflict of interest, we plan to react by excluding such an expert from the process of decision making.
От таких 3 направлених процесів, з 2 з яких ми вже почали працювати.
Дякую, колеги. Ще є питання?
I would like to request you to give comments. In summer this time there were requests from different importers of medicines that different law enforcement bodies get information about some side effects of some medicines. Did you receive such information? Do the law enforcement bodies have the right to collect such information about side effects? I believe that you are asking 2 questions about side effects and how the State Expert Center works with law enforcement bodies. We are trying to work in accordance to the legislation. The procedure of getting access to classified information, confidential information, could be received only if the court rules on that. And also we are collecting the information on side effects. There are more than 20,000 every year pieces of information about side effects. They're systematized and we make them public. We are making it public without mentioning the brand names. This is the international practice, and all the users can get information on what's happening to medicines which have same component.
Ми надаємо інформацію лише через ухвалу суду.
Колеги, чи є ще запитання? Так, будь ласка.
Страшний Владислав Владимирович, доктор фармнаук, профессор.
The modern progressive approach to the process of registration. Well, Viagra appeared only 20 years ago, and this is all happening quite recently. We'll get electronic keys, and the future market authorization holders. Then, what will happen with the tracking? How will it work? Will we be able to monitor the tracking process? In fact, we believe that those who received the key could use them for that. The applicant, when preparing the application, can immediately
Центру інформацію заповнити електронну
can fill in the electronic form of application, to print out the paper version, and to submit this application to.
Після надходження цих паперових документів до центру, а це відбувається в один день по порядку роботи з цими документами, експерт центру
The expert of the center will check whether there is information in eBase. You are saving time.
заяви та реєстраційної форми. Я хочу звернути увагу, що ми б хотіли йти степ-бай-степ і працювати.
We would like to go step by step. We would like to first work with electronic application.
Оскільки це вже інший рівень забезпечення захисту інформації, але ми і в середньостроковій перспективі будемо над цим працювати. Чому ми звертаємо увагу, щоб, власне, заявник вносив? Тому що в кінці всіх процедурних питань, знову ж таки, повноваження заявника, а ми з вами розділяємо цю роботу, вичитувати достовірність даних. Очевидно, якщо в систему ввести в один раз паспортну частину, основні характеристики лікарського засобу, то по ходу експертних робіт ця частина змінюється несуттєво. І ми скорочуємо час на повторне введення на кожному етапі експертизи вручну кожним експертом, і ми плюс отримуємо додатковий бонус, достовірну інформацію в порядку денному, а потім і в проєкті реєстраційного посвідчення. Безумовно, на всіх цих шляхах заявник має право прослідкувати, на якому етапі експертизи відбувається його заявка, коли вона розглянута, коли наданий висновок. І нам би дуже хотілося, щоб крім заявки ми могли відразу після прийняття рішення на тому чи іншому етапі в електронній формі вас інформувати усталеною формою, а не лише в тої паперової, якою ми обмінюємося сьогодні.
Ще було питання, так? Будь ласка.
Інна Мудла, редакція журналу «Містер Блістер». Бували
There were situations when the people in pharmacies would refuse to sell some medicines because they were not registered, and for a few months people could not buy certain medicines. How this term will now be reduced? Can you guarantee that this term will be minimum? We expect that introducing this procedure will give us, will help us save 2.5 months time, but there are bilateral commitments to complete the procedure in timely manner. You need to submit the application on time to expert institution. I believe that the new mechanisms and procedures that we are introducing, when we switch to single registration, this will minimize all the risks that you are talking about. Because previously
Сьогодні щозасідання ми приймаємо більше рішень про безстрокову перереєстрацію, а очевидно
we had to re-register every 5 years, but now there will be no delay with re-registration.
це буде 2-2,5.
It will be 2.5 months shorter. We have time for one more question.
А скажіть, будь ласка,
There was a lot of criticism as to simplified procedure of registration. How many medicines were registered following this simplified procedure, and what you are suggesting now? Is that also the simplified procedure, but for Ukrainian producers? There are two types of simplified procedure, so-called checking and so-called authenticity. We consider 38 applications In 36 cases, we gave positive opinion. In one case, the applicant cancelled the application. In the second case, it was resubmitted again. The simplified procedure is the element of crisis management. That's when we are trying to address some single problem. In medium term and long term, the existence of the medicine in the market requires more information. And now all participants of the market agree with that. Even those who initiated the simplified procedures, the center is ready to do it. We consider the applications in one day. At the same time, our proposals, the answer to domestic producers, any applicant can use electronic application and reduce the time of the medicine being analyzed. Good, all the best to you and see you again. Thank you.
Шановні колеги, наступна подія о 15:30.
Dear colleagues, our next event is at 3:30.